मम्मी को दे फोन, मम्मी को फोन दे। मम्मी दीदी की क्लास होगी दोबारा से, दीदी की।
काट के रख दे, मैं भी बना दूंगी, ठीक है। एक ठीक इतना बड़ा वो छिल दे, अगर बनाना तो बना ले, वरना मेरी 8:30 बजे क्लास खत्म।
This conference will now be recorded.
So good evening everyone. Yes, am I audible with everyone?
Yes,
Hi,
sir.
good evening, sir.
Good evening, sir.
Yeah, good evening.
Yes.
Okay, so I hope everyone is connected. So we're good to start. Okay guys, so still we have the two major topic in our hand. For example, one is a cardiovascular, another one is a E&M. Then that's all. So the CPT will over. Then we have the ICD HIPICs like that. So the coming weekend we are planning for E&M session. So maximum this weekdays we have to complete our session. So the candidate who are all planning for your April exam, so please be prepared. I think 2 or 3 people already ready for exam. So be ready for your next level practice. Okay, so now last session we are discussing the fracture and the spine procedure, and then I'm given question also. I think 1 or 2 peoples they are sending answer for spine procedure, and 2 candidates sending fracture series. So remaining I did not receive the answer. Guys, in your free time you check the question and send me the answer for that, right? Okay, so today we have to discuss one of the major topic. It's a cardiovascular system. So actually in your chapter 3 guys, right, in your chapter 3 you guys are receiving 2 system involvement. One is the respiratory and another one is the cardiovascular. Like that 2 system we have in your CPT. So overall from chapter 6 you guys are receiving 6 question. Mainly in these 6 question, 1 question you receiving from respiratory and 5 question receiving from cardio. This is a exam plan. But for the respiratory system, you guys no need to prepare anything guys. Overall in your CPT book, if you guys are checking me, the 4 procedure we have in respiratory system. One is the nasal endoscopy, laryngoscopy, thoracoscopy, bronchoscopy. That's all. Only the scopy procedure we have. So in this scopy procedure, you guys no need to prepare anything. You guys don't have any concept or you guys don't have any guidelines. So directly whatever they documented, you have to check and you have to code accordingly. That's all. This is for respiratory. So in your assessment, you guys having question from that. But the cardiovascular is not like that. The cardio, we have major topic, we have guideline, we have concept. So all the things we have in this cardiovascular system. Okay, so cardiovascular system mean what is the main location guys? Anyone? What is the main anatomical part we have? Anyone? Cardiovascular mean which organ is very important guys?
Heart.
Heart.
Yes. Heart. But actually comparing to heart, we have another one important organ. What does that mean? The blood vessels guys. So please note down. We are receiving one question from this blood vessel. So please note down what is blood vessel. What is blood vessel? The answer is artery, vein and capillaries. Again I repeat. Again I repeat. Artery, vein and capillaries. These three we consider as the blood vessel. So whatever importance we have to given to the heart, the same importance we need to given to the blood vessels also, because the heart function is pumping. But if we don't have artery or vein, the pumping also is not perfectly given. And please note down guys, the artery carrying pure blood. Right? So the artery carrying pure blood, artery carrying pure blood and vein carrying impure blood. So the artery carrying pure blood and vein carrying impure blood. Right? Okay, this is a very basic thing. Then we go to the heart. So heart mean we have lot of anatomical location, but you guys don't give any importance to anything guys. Just very simple. You guys will know about chamber and wall. That is enough. You guys clear? You have to know about chamber and wall. So please note down guys, in heart we have 4 chamber. In heart we have 4 chamber. So please note down right ventricle, right atrium, right ventricle, and then left atrium, left ventricle, right atrium, right ventricle, left atrium, left ventricle. So this 4, it is called as chamber of heart. So right atrium, right ventricle, and left atrium, left ventricle. So these 4 we consider as a chamber. And please note down, we have 4 valves guys. We have 4 valves. We have 4 valves. What does that mean? Tricuspid valve, and then bicuspid valve, and then pulmonary valve and aortic valve. So we have 4 valve, guys: tricuspid valve, bicuspid valve, and then pulmonary valve, and then aortic valve. So these 4 we are considered as the valves of heart. So we have 4 chamber and 4 valve. So this one you have to know. And one more thing, please note down, guys. In our body, we have one valve. We have one artery. That artery alone carrying impure blood, right? So please note down: pulmonary artery carrying impure blood. But normally we discuss, right? Artery mean carrying pure blood, vein mean carrying impure blood. But only one artery and one vein differently it's working. What does that mean? Pulmonary artery carrying impure blood and the pulmonary vein carrying pure blood. So this one also the anatomical question we are receiving in your exam. Clear? That's all. So the next thing, next one. What is the function of valve? So this question also we are receiving in your exam. What does the function of valve mean? The answer is regurgitation, which means it prevent backflow. So what does the function of valve mean? The answer is prevent from regurgitation. It's a backflow. Clear? Okay. So you guys know the circulatory system, right? So whenever the impure blood enter into superior vena cava, it will directly enter into right atrium, then right atrium to the next part. So then directly it will be enter into the lungs, and in lungs only purification will occur. After the purification, it enter into left atrium, left ventricle, then via aorta it will be go all over the body. So this is called a circulatory system. So mainly one more thing, many of the candidate what they are thinking mean the purification is occur in heart, like that they are thinking, guys. It is totally wrong, guys, right? It's totally wrong. Actually the purification occur in the lungs only. In heart only work is pumping, that's all. Okay, so the chamber, the valve, everything you guys know. Now how the heart will be pumped? So we know that, right? How the heart will be pumped. So in this study of pumping action, it's called as conductive system of heart. So in our heart we have the one more part is called as conductive system of heart. So conductive system of heart, we have 4 parts will be there. One is the SA node, then AV node, then bundle of fish and Purkinje fiber. Guys, whatever we discussed till now, this all the thing you guys already know. I have to revise. This word everyone definitely will know. So one is SA node, then AV node, and then bundle of fish and then Purkinje fiber. So actually the heart will be pumped mean we need one important thing. What does that mean? We need the electrical impulses. So this electrical impulses, how it will be done? Because of SA node. So you guys everyone studied the natural pacemaker of heart is SA node. So whenever the SA node will be producing the impulses directly enter into AV node, then AV node to bundle office, and with the use of Purkinje fiber, it will be go all over the heart. So this is because of this reason only the heart will be pumped. So the natural pacemaker of heart is called as SA node, sinoatrial node. So whenever the patient having any problem in this SA node, that time the provider will be inserting the artificial pacemaker. So the first topic what we have to discuss mean the pacemaker, guys. Right? Okay. So the natural pacemaker of heart is SA node. So in this SA node, whenever it's not producing the impulses, that time we are using artificial pacemaker. So I am given the code sets also. Guys, one thing don't forget, in this pacemaker, we don't have any concept or any guideline, guys. We don't have anything. But the only challenge is we have multiple code sets. So what is my suggestion mean? Whenever you guys are attending the pacemaker question, please spend additionally few minutes, like 5 to 10 minutes. You guys additionally spend, no issue, because if any question we have concepts or guideline mean, we have to apply that. But this pacemaker question, we don't have anything like concepts or guideline, nothing is there. So you guys, what you have to do mean, additionally few minutes if you spend, then you guys are getting answer. So that's the reason we have to discuss. Now I will tell you, if you guys follow this key point mean, you guys easily get the answer in this particular pacemaker. So we discuss one by one. The first key point, what you have to check mean, you have to check how electrode plays to the heart. So we have two types. One is the epicardial and the transvenous. Like the two method of electrode insertion the product plays. So epicardial mean the electrode placed the surface of heart, and the transvenous mean electrode placed in the vein. So whenever you are getting any question from pacemaker, your first point you have to check whether the provider perform electrode in epicardial or transvenous. So this point you have to check. The next one, and one more thing please note down, guys, and one more thing please note down. If there is no documentation about epicardial or transvenous, right? If there is no documentation of epicardial or transvenous, you have to go with epicardial is a default one, guys. Right? So if there is no documentation about epicardial or transvenous, we have to consider transvenous is a default one. So this is one. Right? And next one, you have to check what type of pacemaker, the product perform. So first one you have to check how electrode plays, and next one you have to check what type of pacemaker. So we have four type of pacemaker, guys. It's a single chamber, dual chamber, biventricular, and multiple chamber. So this is a four type. So Very simple. What does single chamber mean? The electrode placed in one chamber mean it is called a single chamber pacemaker. And then the next one, dual chamber mean the electrode placed two chamber. So it is called as dual chamber. And biventricular mean the two electrode placed in ventricle. This is called as biventricular pacemaker. And the last one, multiple chamber. So the electrode placed all the four chamber. It is called as multiple chamber pacemaker. So I will tell you two advantage, guys. In your exam, we have two advantage. What does that mean? The first thing, we don't have any code for biventricular or multiple chamber pacemaker. This is the first advantage. In your CPT book, you guys having only single chamber, dual chamber. That's all. So you guys don't have any code for biventricular or multiple chamber pacemaker. So this is first advantage. And second advantage is the one chamber, two chamber given, right? It is atrium or ventricle. That's all. You guys, in chamber we already discussed, right? We have the right atrium, right ventricle, left atrium, left ventricle. So you guys no need to check right or left anything. If the provider documented atrium alone mean it is a single chamber. Atrium and ventricle mean it is a dual chamber. So like this you have to calculate. So the first point you have to check how electrode placed to the heart. And the second point you have to check what type of pacemaker the provider perform. Right? This is the second one. The third one is you have to check permanent or temporary. You have to check permanent or temporary. Right? Okay. So sometime the provider using the pacemaker for temporary purpose also. For example, during the surgery time, the provider they have to use the temporary pacemaker, right? So for example, sometime during the surgery time, suddenly the electrical impulses will be coming low. So that time what happened mean for the temporary purpose, the provider using the pacemaker. So the permanent pacemaker mean if the patient having problem, that time they are using. So this is the difference. So in your question, if there is no documentation about permanent or temporary, you have to consider as a permanent is the default one. So this is the next point, right, guys? But 98% we have to go for permanent only. The temporary is very rare one. Okay. And the next thing, the last one, you have to check what procedure the provider perform, either placed or removal or revision. For example, we already informed from outside the provider will be doing any procedure. You have to check whether the provider perform placement or replacement or removal. So these point you have to check. If you check this 4 point, you guys are getting answer in this pacemaker. Once again, repeat. The first one is you have to check how electrode placed to the heart. The second point you have to check what type of pacemaker. And the third one you have to check permanent or temporary. And the fourth one, what procedure the provider perform. If you guys checking this 4 point, you guys are getting answer in this pacemaker procedure. But don't forget, whenever you are receiving this question in your exam, please spend extra 5 to 10 minutes. Then you have to search the answer. Then only you are getting correct one. Because we have multiple codes. So if multiple codes, any scenario we are receiving, we are getting mistake very easily. So you have to concentrate that. Okay, now we are discussing all the thing. But you have to know how to pick the answer like that. Okay, now I will share you 3 questions for your homework, guys. Please note down this. Now, whatever the points we are discussing, based on this, you guys will check the code and send me the answer for this. Please note down this, guys. So once you guys completed this, please update me, guys.
Completed, sir.
Okay. Okay, guys. And one more thing, guys. We are discussing, right? All this is, the topic is ICD and pacemaker, guys. Actually, the pacemaker, ICD, both are different. ICD mean you guys don't think international classification of disease, not like that. Actually, the ICD mean here, what does the meaning mean? Implantable cardiac defibrillator, right? So ICD mean implantable cardiac defibrillator, but the code sets, key points, everything is same only, but only the pacemaker ICD is, we have small differences there. What does that mean? Pacemaker mean it will help only one function. For example, if one patient having minimal electrical impulses, that time if the pacemaker, if you are used to mean the patient getting electrical impulses, this is pacemaker work. But ICD work is different. Whenever the patient want electrical impulses, that time the pacemaker will producing the electrical impulses. At the same time, if some patient having more electrical impulses, like it's a heavy electrical impulses, that time the ICD will be reducing the electrical impulses. So the ICD is working for two function. So you guys just imagine, pacemaker is the least one, ICD is the high one. This is a different, but the code sets will be similar. So both ICD pacemaker, the code sets they given together only. So after this session, whenever you guys are getting free time, you guys check this key point. Along with, you have to derive the answer for this 3 question and then send me. If wrong, I have to give you the correct one. Guys, clear? That's all about ICD and pacemaker. So this is one. Sometime you guys are receiving 2 question or 1 question from this topic. So this is one. The next one we have to discuss is the ECMO, guys. Right. So I'm sharing the slides for CABG, but tomorrow we have to discuss CABG. Right. So actually, I'm planning today pacemaker as well as the CABG. The two I am planning, but the pacemaker ICD we have discussed. Now we discuss ECMO, because why mean the pacemaker and the CABG both are major procedure. So if single day two major procedure if I am discussing mean, you guys are feel some tough. So the CABG we discuss tomorrow. Now you guys please note down the heading is ECMO, guys. ECMO, ECMO. ECMO, ECMO. Okay. So ECMO mean, guys, this one also very important topic only, guys, right? In your exam, this one is very important, and very easily you guys are getting answer. And one more thing I want to tell, most of the coders who are all go for the CPC exam, 80 to 90 percentage of people, they don't know how to code ECMO. Actually, this is true, because whenever they go for the coding, the ECMO code sets, if they are checking mean, definitely they have to avoid the question. They will not attend, because directly if you guys are checking the code sets, it feel it is very difficult. But I have to give you one easiest method of coding, guys. If you guys apply this method, within a minute you guys are getting answer. Right? It's a very interesting topic we have to discuss now. You guys please note down the heading ECMO. So ECMO mean, please note down, guys, extra corporeal membrane oxygenation. See, this is the abbreviation, guys. Extracorporeal membrane oxygenation.
हाँ
Right? Okay. Extracorporeal membrane oxygenation. So the ECMO is not a surgery, guys. You guys don't think maybe ECMO means it's a surgery. It's not a surgery. The ECMO mean it's a machine. I don't know how many of you guys have seen. Maybe the nursing people, they've seen this. So nursing candidate Tina, Nina, Anandi, you guys anyone seen the ECMO in your nursing career? Okay. So just I want to tell you guys, the ECMO mean it's a machine. Whenever the patient want respiratory or cardiac support, that time this ECMO we are using, right? If the patient want respiratory or cardiac support, maybe in 2005 in all the news channels they have telecast about ECMO. I don't know how many you guys have remember. Whenever the Tamil Nadu CM is admitted in ICU, that time we are using the ECMO, the heart failure, lung failure, like that they given the news, everything about the ECMO. So very rarely we are using ECMO, but it's a high cost one, because you just imagine the cardiac will be failure and the lungs will be failure. That time the ECMO will take caring of function mean, how much it will be take the payment. It is huge, right? So whenever the patient getting heart failure or lung failure, that time we are using this ECMO. Mainly in this ECMO we have two method, guys. One is a veno-arterial method, another one is a veno-venous method. Okay, you guys note down this slide and update me, guys.
दोनों लगे हैं।
If you guys completed this, please update me, guys.
Completed, sir.
Okay. Okay. So we have two method, guys. One is the veno-arterial method. Another one is the veno-venous method. So what is the different mean? If the patient having lung failure, that time the provider directly they have to actually the ECMO machine, guys. It's look like normal machine only, right? So in this ECMO machine, we have two tubes actually. The tube name is called as cannula. The tube name is called as cannula. So if the patient having lung failure, mean the provider what they are doing mean in the two tube they have to place it in the vein. So that's why it is called as venous method. Venous mean vein. In case the patient having heart failure mean the one tube they connected with vein and another tube they connected with artery. That's why it is called as veno-arterial method. So based on this method only the codes will differ, guys. So don't forget the ECMO mean we have two method. One is for veno-venous method. Another one is the veno-arterial method. So how we are know with this venous or veno-arterial mean based on the condition. If the patient having only lung failure mean you consider as the veno-venous method. If the patient having heart failure mean veno-arterial method. In case the patient having heart and lung failure, this time also you have to go for veno-venous only. Once heart will come, you go for veno-arterial method. Clear? Okay. Now the code sets everything you guys have, right? You guys see the screen 33946. So now I will give you some key point, guys. If you guys follow this key point, within a minute we are getting answer. So it's an interesting topic. Wait, I have to show you. Okay. So you guys see the screen? Yes. So with the use of these flow chart only, we need to code the ECMO, guys. Guys, this flow chart you guys no need to search anywhere. In these ECMO code sets, if you guys are checking in your CPT book, you guys having this flow chart. With the use of this flow chart only, we are coded the ECMO. So I will teach you very easy manner. Okay, one by one we will discuss, guys. Please note down the heading key point. Right? So the first key point is you have to check what procedure the provider perform. Again I repeat. Again I repeat. The first point you have to check what procedure the provider perform. In that bracket, please note down. In the bracket, initiation, comma, subsequent, the first one is initiation and then subsequent And then third one is decannulation. Guys, clear? Initiation, subsequent, and decannulation. So initiation mean the first time the ECMO is placed mean it is called as initiation. Right? The first one is initiation mean the first time ECMO perform. The first time if the provider placing the ECMO, it is called as initiation. And then subsequent mean, you guys please note down, if the provider documented continue ECMO. Continue ECMO. If the provider documented I am continue ECMO, or else the second day ECMO, third day ECMO, like that anything they documented, we consider as a subsequent. And third one, decannulation. Right? So this is called a subsequent. And the decannulation mean this is for removal. Right? Decannulation mean it's a removal. So whenever you want to code ECMO, the first point you have to check what is the procedure the provider perform, either initiation or subsequent or decannulation. Initiation mean the first time ECMO is performed. Subsequent mean they continue ECMO. If the provider document I am continue ECMO, or second day ECMO, third day ECMO, like that they given, you consider as a subsequent. Decannulation mean removal of ECMO. So this is the three thing. Then second key point, please note down, you have to check management option. The second key point, you have to check management option. So management we already discussed, right? Either veno-venous or veno-arterial. So you have to check management option. And third one, you have to check cannula inserting approach. We have to check cannula inserting approach. Cannula inserting approach. You guys please note down in bracket. Right, in bracket please note down percutaneous, comma open, comma, sternotomy or thoracotomy. Percutaneous, comma, open, comma, sternotomy or thoracotomy. And then last key point, you have to check patient age. The last point, you have to check patient age. Right? That's all. Once again, I repeat. First point, you have to check what procedure perform. Initiation, subsequent or decannulation. Second one, you check management option. Third one, you check cannula inserting approach. And the fourth one, patient age. If you guys are checking this 4 point, you guys are getting answer in this particular topic. Now, whatever we are discussing, we already have in your CPT book. You guys see the screen? The first point, initiation and then subsequent decannulation. Is it right? Then management option. Then cannula inserting approach. Then patient age. That's all, guys. So, based on this, you have to code. Okay. So, I hope you guys, everyone note down this. Now, I will give one homework question for ECMO. Right? You guys note down this question. After this session, you guys check and send the answer for that. Right? Okay, please note down, guys. The question is, the question is the 4-month boy have severe respiratory failure. The 4-month boy have severe respiratory failure. MD continue ECMO. MD continue ECMO. MD continue ECMO via open approach. Again I repeat, 4-month boy have severe respiratory failure. MD continue ECMO via open approach. So in this particular question, you guys lead the code and send the answer after this session. Clear? That's all, guys. So today we are discussing ECMO and then we are discussing pacemaker. So tomorrow we discuss cardiovascular, CABG, along with some of the minor procedure is there, the exam oriented question we have to discuss tomorrow, guys. Clear? So today I'm given 4 questions. Whenever you guys are getting free time, you have to lead the code and send me the answer for that. And the ECMO question, don't forget, guys, the management along with ECMO, 2 code you have to use. Management code also you give, along with ECMO code also you guys give. Clear? That's all, guys. That's all. So thank you everyone, guys. See you tomorrow. Bye everyone.